Fentanyl has really changed the landscape of Solano County in that it is so lethal. We have seen so many deaths from fentanyl poisonings throughout our county, so it's been very alarming for all of us.
2024 thus far, about 70% of the overdose deaths had fentanyl involved.
Fentanyl is a very dangerous drug. The DEA actually has proclaimed that it is the most dangerous drug that they are combating right now.
The scale of the crisis has grown exponentially in the last, I would say, 5 years. Over the last year, we've seen an uptick in narcotic overdoses.
Upwards of 26,000 pills have been recovered here in Solano County alone, and along with 2 pounds of pure fentanyl.
It used to be that almost everyone I saw coming in for treatment, especially at the methadone clinic, were coming in for heroin use disorder, but now it's almost universally fentanyl.
It's also hit our schools pretty hard. I haven't seen methamphetamine or heroin, for example, just totally affect our schools the way that fentanyl has.
Fentanyl-related deaths begin gaining more and more attention in the news. Understandably, our parents were scared, the things they were hearing, the things they were seeing.
It affects everybody, rich, poor, doesn't matter your race, gender, orientation. It is a human problem, and we as humans need to address this.
In 2023, an estimated 108,000 people died from drug overdose in the United States alone. 69% of those deaths were from fentanyl.
Between 2019 and 2021, California's opioid-related deaths spiked 121%. The vast majority of these deaths were linked to fentanyl.
In 2023, 71 people died in Solano County from opioid overdose.
6 out of 10 counterfeit pills are laced with fentanyl, and they're not just in dark alleys anymore. They're in every community across America, including ours.
Fentanyl is a synthetic opioid. In the right setting, it can be a very powerful, useful drug for people that are struggling with acute pain.
The area of the brain that controls pain and emotions houses opioid receptors. When fentanyl binds to those receptors, it increases dopamine levels, putting the individual in a feel-good state of bliss and calm.
Unfortunately, because it's synthetic, it can also be too easily manufactured and sold on the street and can be extremely dangerous. It's very potent, much stronger than almost any other opioid out there.
Fentanyl is 50 times more potent than heroin and 100 times more potent than morphine.
Fentanyl is a synthetic opioid that was specifically created to fit into your brain's receptors like a puzzle piece, making you even more vulnerable to its effects. This is why such a small dose of fentanyl can be deadly.
Whether you take it by pill, whether you get some on your skin, there's so many ways for it to get into your bloodstream, it doesn't take much. And because it's such a small dose that's required for it to knock out your respiratory drive, like I said, it doesn't take much.
Opioid receptors also live in the areas of the brain that control breathing. Deadly doses of fentanyl will cause your breathing to slow until it stops completely.
Fentanyl is a silent killer, and it's cheap to make. It's a for-profit business, and the clientele that basically they're looking for is repeat customers.
Well, I have been told by dealers that when people OD on their stuff, it actually makes their profits go up. That's how you know that it's cut with something that's gonna get them high, and gonna get them high faster.
The reason that these drug dealers started lacing it with fentanyl is because people are able to get a better high off of it. It's more potent. They're able to get their victims hooked. They're actually targeting younger people. They're coloring them to make it look like Skittles, Sweet Tarts, or whatever it may look like, because that tells you they're looking for now below high school students. You're looking in the junior high school and even lower.
A lot of the fentanyl is coming from Mexico. I know they have brought chemists from China over, and I think some of the cartels are now knowing how to make it themselves. The cartels are really big into making things with fentanyl in it and also distributing fentanyl up here
good fentanyl that's made in a pharmacy, you know exactly how much is in that dose. For counterfeit pills, for stuff that's mixed into marijuana, edibles, whatever it is, you don't know how much you're getting. And fentanyl is so potent, it doesn't take much for it to be a lethal dose.
I've had several patients that had no idea that they were even taking fentanyl. They thought they were taking or buying, oxycodone. That's one of the most commonly counterfeited pills, and they can make it look almost identical. They can manufacture these pill presses that can, put the same print stamp on the pill, same size, same color, and it can be, even for investigators who are, used to knowing what they're looking for, pharmacists have a hard time telling the difference between these fake oxys and the actual real oxycodone.
When someone is looking for maybe a Xanax tab for anxiety or whatever it may be because they're studying for a test or they're applying for colleges or the pressure maybe the parents may be putting on them, they're looking for something to relax, and they usually go to a trusted friend who they say have a trusted friend. And the reality is we don't know what's in that.
A lot of times you hear youth saying they trust their dealer, or my dealer's my friend, they would never do that. That may be true, but they, in fact, don't know either. In addition, the entire process of the dosage is random.
It's like when you make a batch of blueberry pancakes. Some of your pancakes are going to have a lot of blueberries in them, and some of your pancakes aren't going to have very many.
Well, the problem with the pills are, what they do is they take the actual medication and they take fentanyl and they mix it together. So when you have the pill, you don't know, is there 5% of fentanyl in that pill? Is there 85% fentanyl in that pill? And so when people are taking pills, that's why if you and me buy pills from a dealer, I could take it and be fine. You could take it and OD because you had the one that had 75% fentanyl in it, and I had the one that had 5%.
There's different strengths of fentanyl. Depends on someone's body habitus, their individual metabolism, if they've ever been on opioids in their life before, they're completely opioid naive. So there's so many different factors, but yes, an incredibly small amount of fentanyl, even specs, can be fatal in some conditions.
Late last year, we get dispatched for a patient not breathing. When we arrived on scene, somebody was doing CPR on the patient. Bystander tells us that he brought an ecstasy pill, they cut it in half, and 4 people had a half of an ecstasy pill, of 2 pills. So one guy went down and almost died, and the other 3 patients, they had very, very close encounters with death because of a half of a pill that had fentanyl in it.
One of the biggest issues that we see is individuals who think they're taking an Adderall to study for a final exam, or some other medication or pill that they bought from social media and don't realize that they're getting a large dose of fentanyl for their bodies and are not used to taking opiates.
But Anthony went to Vaca High and was a pitcher for the baseball team, even for the Bulldogs. He started taking pain medicines without me knowing. And he went and bought 3 pills. And when they do the autopsy and when they tested the other pill, it was all fentanyl. You killed him instantly.
When people think of an ideal drug user, they picture people in our community, maybe homeless, or you see them screaming on the sidewalks. That's not it. This is penetrating our homes.
I've learned that a lot of people use when they're teenagers. Sometimes I've heard as young as like 12, 13 years old. Maybe dad beat them, maybe they were molested as kids, maybe they were in foster care or something like that. And they use that to cope with their problems in an unhealthy manner.
There's economic challenges, there's so many factors, increasing rates of mental health issues that can drive people to just want to escape. They are offered a substance that can, be a very powerful temporary escape, but unfortunately the long-term consequences of that, or even the extreme risk if someone overdoses accidentally, can be devastating.
So last year we had a 15-year-old girl that overdosed in the recreation area at Armio. She thought she was taking a weed brownie, that she ate that morning, and her friends found her passed out on the blacktop. They brought her into the school office and administered Narcan. The school resource officer administered his Narcan. We got there, administered our Narcan, so it took about 12 milligrams of Narcan to reverse the effects. And yeah, she was able to snap out of it and wake up. Her friends hadn't noticed her. When they did, if she had gone to the bathroom and passed out in a stall or something like that, she wouldn't be here today.
There's a lot of trauma out there amongst our students that can come in many forms. It could be family dynamics, it could be mental health issues, it could be self-esteem issues, anxiety, that can come from a number of sources, all of which makes our students more likely to self-medicate or find ways to cope.
Data obtained from the National Addictions Vigilance Intervention and Prevention Program shows that 73% of adolescents use substances to feel calm or relaxed. 50% used it to help them sleep. 44% to stop worrying or forget or for excitement, and 41% to help with depression or anxiety.
If you're having mental challenges, your use of substances may be exacerbated and made worse, and so the two often can go together, and we call those kind of co-occurring situations where someone has a mental challenge and they also are using a substance, and so you want to treat the whole person and address both simultaneously.
If you have teenagers, you need to be really aware of who they're following, who they're hanging out with, what's going on their social media sites, because more than likely, if they are thinking or they at least know how to get it.
You know, in the good old days, you had to know someone. And now you have social media that, you know, affords anonymity.
Smartphones have made it easier than ever for drug dealers to target youth. But as a parent, the messages may be both hard to find and decipher.
They're advertising on their stories. They're using little emojis or little slang words.
I've seen menus just pop up on social media profiles that are advertising various substances for various rates. And so you don't need to have that connection anymore. You just can simply search terms, look for profiles that provide that, and then do so anonymously on both ways.
To help parents and caregivers, the Drug Enforcement Administration released an emoji drug code reference guide. Some of the most common drug emojis include a pill for fake prescription drugs like Xanax and Adderall. Xanax is also sometimes marked by a chocolate bar or a bus. Meth is represented by a crystal diamond. Cocaine, a snowflake. MDMA, a lightning bolt. Marijuana, a green tree. A chocolate chip cookie indicates a large batch of drugs available. Rockets, bombs, and an explosion can indicate the drugs are really potent. Emojis of bags of money, cash, and even an electric plug can show that someone is trying to sell drugs.
Everything's electronic, usually through a cash app of some sort, so it's a quick trade. It's not even the hand-to-hand that we're used to seeing when we were younger. So it's a little bit harder to trace, but once we find out, usually we're able to use the investigative steps necessary to find out who provided it, hopefully, and then even follow that even further.
Our investigators, working together with our law enforcement agencies, we are aggressive with respect to going after those who actively furnish fentanyl knowing it can cause the death of others. From county to county, everyone has different approaches in terms of, you know, a lot of people say, I'm going to look at every fentanyl poisoning as a murder scene, and we're going to try to look to see, can we prosecute somebody that's furnishing fentanyl that leads to a death? So it's called implied malice murder, which is you do something that endangers people's lives and you do it with the reckless indifference to that life, knowing it can kill them. We look to see whether we can file a murder charge on that individual. We brought in Placer County because they were the first county that got a murder conviction in somebody furnishing fentanyl, and which led to a death. So we brought them in for training last December.
Detective Patrick Craven helps lead the newly formed Placer County Opioid Response Team. His investigation into the 2022 fatal fentanyl poisoning of 15-year-old Jules Wolfe led to California's first murder conviction of a drug dealer for providing fentanyl-laced pills.
Nathaniel Kabakungan put out there that his pills did not contain fentanyl, and that was not the case.
Melanie Ramos was only 15 years old when she overdosed on a fake Percocet that was laced with fentanyl at her high school in 2022. As a result, Melanie's Law SB 10 was introduced by Senator Dave Cortez of San Jose. The law requires California schools to incorporate protocols for responding to student opioid overdoses. The law went into effect January 1, 2024.
In September of 2022 is when it came down the pipeline that we need to revise our policy to include the training and having Narcan on school sites to help if a student were to overdose on fentanyl. And so we revised both our board policy and our administrative regulations to allow for that training. We contracted with a gentleman named Jason Johnson, who actually used to be a school resource officer. So he came on board and he trained all of our site administrators on what the signs and symptoms are for an overdose, and then how to respond and how to give that Narcan to the student.
We just felt this immense sense of urgency that we needed to be proactive. We needed to educate our families, staff, students, and community about the dangers of fentanyl. The very first thing that we did was we joined with Vibe Solano in their One Pill Can Kill campaign.
For the past 3 years, we have been focused on developing fentanyl prevention media campaigns. We focus on primary prevention. We target youth ages 12 to 27. Our goal is to prevent addiction so that individuals can grow up and flourish in our communities without having addiction as part of their lives, where they can't be productive citizens in our communities. From these campaigns, other events and partnerships have developed.
Last year we did some fentanyl town halls, partnering with the school districts, trying to raise the awareness level out there.
The very first town hall meeting that we held, I didn't know what to expect. And we had a family come who had experienced a loss of one of their family members due to fentanyl, and we didn't know they were coming. And so they got up and they shared their story. And that was very powerful.
Some of the outreach that we've done with respect to the educational component of fighting fentanyl crisis, we've tried to reach out to a number of the high schools here throughout Solano County. We really want to hit as many high schools as we can and spread the message about how dangerous the use of fentanyl is.
The DA has asked us to come and do presentations at local high schools. The kids from that high school have taken part in videos where they've explained the dangers of fentanyls, and these videos are shared with other schools. So it's youth helping other youth to learn about fentanyl, and we think that's very powerful.
We never want to think about, our kids out there experimenting and dealing with all these things, but the reality is they are sometimes.
We have to be willing to have uncomfortable conversations with our kids because they're worth it.
And having conversations with your kids of the dangers of just buying a pill from somebody on the street, and what it could be mixed with, and what obviously the worst possible scenario would be, which is you dying.
Really, it's just being in tune with what your child is doing as a parent, find out what's going on, really pay attention to who they're hanging out with, and identifying opportunities for them to find coping mechanisms.
Talk to your kids, have that open line of communication, because if they're doing things that you don't know about, you can't help them and you can't teach them.
If you're going to get a prescription medication, make sure it's from your doctor. Do not use anybody else's prescription medication.
If someone walks into one of our clinics, we can get them connected to treatment. If they call our access line 24/7, anytime, that number can connect someone to someone who can connect them to treatment.
Let's empower them with the knowledge that to survive. Let's empower them with the knowledge to be able to look for signs of struggle amongst their own peer groups.
Yes, we could have very good kids, and yes, they may never be interested in touching drugs, but that doesn't mean that they may or could be in a situation where they succumb to peer pressure. And that's why we have that campaign, One Pill Can Kill.